So the GEM-SELIBORDARA study is a Phase II study that is evaluating Selinexor in combination with Daratumumab, Bortezomib, and Dexamethasone in a population of patients with relapsed refractory multiple myeloma. So this study has two parts. So in the first part, patients with three or more prior lines of therapy that were previously exposed to proteasome inhibitors and immunomodulatory agents were enrolled. And in the part 2, patients with progressive disease or relapse after one single line of therapy were allowed to be enrolled. So the population from the part 2 is completely different from the population of the part 1. The population in the part 1 is a more advanced myeloma patient population with a median of 3 prior lines of therapy, and the majority of the patients, 96%, were lenalidomide-refractory, and also 71 were refractory to both lenalidomide and proteasome inhibitors, whereas in the part 2, the population was of early relapse with a median of only 1 prior line of therapy, and only 45% of the patients were refractory to lenalidomide. So the overall response rate in the part 1 was 58%, and it was higher in the part 2 with an overall response rate of 82%, and responses were more or less comparable among part 2 patients that were refractory or not refractory to lenalidomide, with a tendency to a higher response rate in those patients that were not refractory to lenalidomide. So regarding the median progression-free survival, so for the part 1, after a median follow-up that is quite long, of close to 40 months, the median PFS is 7.2 months, and the median overall survival was 28 months. And in the part 2, the patients were, as I mentioned before, less heavily pretreated. And with a median follow-up of 27 months, the median progression-free survival was 25 months for the whole cohort of patients, and was a little bit longer, 27.2 for those patients that had only received 1 prior line of therapy. So we believe that these results are encouraging with the addition of Selinexor to the standard DVD arm. So the safety profile was consistent to that of the DVD combination and Selinexor, and notably the incidence of gastrointestinal toxicity was manageable with prophylactic treatment and supportive care measures. So we believe this is a potential new combination that may be considered as a potential option in patients that have received 1 prior line of therapy, but for sure the results need to be confirmed in a larger data set of patients.